Yes, I'm ready.
Are you ready?
Yeah.
Okay, so if you've read and understood considering it surgical pathology station, please tell me how would you reply to the answer?
This is
What
uh,
exactly is
the
it?
right big toe gangrene,
Okay,
most likely dry gangrene.
please define the term gangrene first.
Gangrene is acute ischemia of the organ or the limb, lead to necrosis of the tissue.
Okay, what do you mean by the term necrosis?
Necrosis is pathological cell death that uh, that need energy.
Can you explain? Can you give example? What do you mean that needs energy?
Uh, mean the necrosis is a pathological cell death where the nucleus underwent chirolosis, cell membrane disrupted, and uh, and the granule and the cytoplasmic organelle become a granule. Uh,
Please tell me the difference between necrosis and apoptosis.
Apoptosis is a programmed cell death and usually is physiological. The apoptosis need energy and necrosis does not need energy.
Okay.
Also, the cell membrane usually intact. The cell is shrunk in the apoptosis, while in the necrosis is the cell is swollen. Cell membrane intact in apoptosis. Nucleus also in, cell membrane is intact, and the nucleus is intact, and it need energy to cell to die.
Okay. Please tell me, and since it's a pathology station, so please tell me the pathogenesis behind necrosis.
Pathogenesis of
Necrosis.
necrosis is usually due to ischemia for the tissue,
Yes.
where the cell underwent autolysis and uh, rupture of the cell
Begin.
membrane and digested by the lysosome.
Yes,
And
but before that, yes, there'll be severe
also,
swelling of mitochondria, which
yeah,
will lead to calcium influx into
yeah,
mitochondria. Then cell will
and
rupture,
cytochrome,
cell
yeah, and cell,
into the cell, and then there'll be rupture of the lysosomes
yeah,
into plasma membrane, and okay, then this will lead to death by necrosis and apoptosis due to the release of
cytochrome
cytochrome
C.
C, yes, from mitochondria. Okay, what are the different types of how would you classify necrosis?
Fibrinoid necrosis, caseous necrosis, and granulomatous necrosis, and fat necrosis, and liquefactive necrosis.
Okay, please give me examples of coagulation necrosis.
Coagulation necrosis, coagulation like a heart infarction.
Very good. Okay, heart and kidney. And right. And this kind of necrosis that you're looking at in front of you is example of which type of necrosis?
Ischemic necrosis
Which
means mixed
OSCE?
between coagulative and
Yes.
ischemic necrosis.
Okay. What is the difference? Because you mentioned this is the dry type of gangrene. So
Yeah.
what is the difference between wet and dry gangrene? What?
Dry gangrene usually in the limb, wet gangrene in the bowel,
Yes, and
the infection in the wet, and there in the wet and dry in the dry gangrene. Also, there is a demarcation line in the dry gangrene. There is ill-defined margin in the wet gangrene.
wait. First of all, dry gangrene is primarily characterized by coagulation necrosis without liquefaction. Okay, that's the basic difference. And then wet gangrene is coagulation necrosis, which is complicated further by the infective.
Infection.
Yes,
And
infective.
and the
And
dry is by
liquefaction as well.
arterial. Yeah, and the dry is usually by arterial compromise arterial supply, while the wet by venous
Okay,
compromise.
one more thing. Please tell me what are the risk factors which give rise to to gangrene?
Ischemia to the organ.
No, more risk factors.
Risk factor: hyperlipidemia, diabetes,
Yes, yes, and family history
and family history. Yeah,
and increased LDL. All right.
hypertension. Yeah, and smoking.
How does patient presents? What are the signs and symptoms with which patient presents?
Gangrene.
Yes, please.
Severe pain in the limb, maybe discharge, change in the color, claudication,
Okay.
maybe. Also history of family history of DM and lower limb ischemia.
Yes, and there
And
is bad
so,
habits as well. Okay, what is the treatment that you can offer this lady?
according to her condition, if it's infected, she need maybe antibiotic and debridement and amputation. If it is
Yes,
dry, it could be lift
it's
and
in front of
care.
you. Yes.
Yeah, it can be left and wound care till auto amputation occur.
Okay.
And
And
also anticoagulant also to rule to correct the cause of this gangrene.
okay, right. And all right, considering the wet and dry gangrene, please tell me how their outcomes turns out to be.
The outcome of the gangrene,
Yes, please. Wet and dry.
it could be auto amputation if it is dry and no infection, or infected. It could lead to toxemia and septicemia and may complicated and
No, no,
increase the
no, no.
infection.
Outcome, like in
Outcome:
case of dry
auto
gangrene.
amputation or complicated with infection and increase of the
Okay.
progression of the gangrene.
Okay, the mode of spread, I wanted to ask you, but I said outcome. So, all right. The mode of spread is that it's due to it leads to the presence of clear demarcation, whereas the wet one, it spreads directly, a direct extension, and there is skipped lesion. Here, there is defined margin. Okay. How would you classify cell death?
Cell
Broadly.
death, broadly apoptosis or
No, no, no,
necrosis.
no. Broadly into programmed cell death and non-programmed cell death. And then programmed cell death again,
Yeah,
caspase
I
dependent
don't.
and non-caspase dependent, right? And whereas non-programmed death is oncosis, which is in return necrosis. And then if I ask you to give me examples of
Uh, I didn't.
caspase dependent and caspase independent. Okay, you
Okay.
can read that later and tell me, because there are five, at least 5 examples of each. Right. Okay. Right. Okay. Thank you so much.